As a person with a disability, you have the right to be considered for the treatment and equipment you need through the same framework as anyone else. My name is Annette Yazzie, and I'm an advocate with the Native American Disability Law Center. I want to share with you a problem affecting Native Americans with disabilities on Indian country. Specifically, I want to talk to you about the levels of medical care everyone is entitled to when they go to an IHS hospital with COVID-19. Ideally, when someone is sick, they get the treatment they need to make them better. However, when many people are sick at the same time, the healthcare system can't treat everyone. They may have too few doctors and nurses, medicine, or medical equipment. When healthcare workers cannot treat everyone, they have to make decisions about who gets the treatment they need and who doesn't. This is called medical rationing. For example, a rationing policy may hold that a person with a severe intellectual disability will not be provided a ventilator, or that a person with muscular dystrophy will not receive care in times of shortage. This is wrong, and you need to know that you and everyone else has a right to be considered for medical treatment, regardless of whether you have a disability. Right now, Indian country is experiencing an increase of COVID-19 cases at an alarming rate, and a number of patients who are sick may be more than IHS hospitals can manage. Last month, the Office of Civil Rights for the Department of Health and Human Services published guidance that requires hospitals to comply with civil rights laws that protect people with disabilities, like Section 504 of the Rehabilitation Act and Section 1557 of the Affordable Care Act. This guidance includes these 5 guiding principles. 1. Decisions must be made based on individual situations. 2. Decisions cannot be based on assumptions that people with disabilities have lower qualities of life, or 3. A lower prospect of survival. 4. Decisions cannot be based on perception that people with disabilities have higher treatment needs. And 5. People qualify for COVID-19 treatment if they need it, and it will make them better. How does this apply to IHS? IHS is the main healthcare provider for over 2 million Native Americans. It is also a federal agency under the Department of Health and Human Services. So IHS hospitals must comply with these guidelines. Right now, we're not sure if IHS is following these guidance because they have not publicized their medical rationing policies. There is a possibility of medical rationing for COVID-19. It's possible that when you go to an IHS testing site or hospital, there might not be enough tests, medical personnel, or medical equipment like ventilators. If you have COVID-19 symptoms and request care at the IHS hospital, be prepared to advocate for yourself. Know the 5 guiding principles that I just mentioned, and if you are not equally considered for treatment, let the staff know that what they are doing is wrong and illegal. It also helps if you have a family member or friend with you to make sure you get the treatment you need. If you are denied medical care or treatment at an IHS hospital, you should immediately demand to speak with the doctor in charge or the chief medical officer and tell them that they are violating HHS guidance. Later, when you can, file a complaint with either IHS or HHS. You can also contact your local area Indian Health Service director, or you can also contact your tribal and council leaders, your local news media. You can also contact us here at the Law Center at 505-566-5880. In addition, you can post on social media platforms like Facebook or Twitter, voicing your stance on this issue. I hope that this information I provided about medical rationing is helpful. Thank you.